My work tends to be a blend of active release techniques, myofascial release, and deep tissue massage, specifically trigger point therapy. And when I'm treating low back pain, I will look at the entire body. It's not just what's happening in this area. It's really what's happening from the head to your toe and how those muscles and alignment can affect the low back specifically. So, and you can see with Lily, she has a little bit of an anterior pelvic tilt, an exaggerated lumbar curve called lordosis. What that would tell me is that her hip flexors are probably a little bit tight and potentially the lumbar erectors in here. So everything's kind of pulling her forward. And she's not too bad. A lot of people, it's very excessive, and that's a lot of times where the problem is coming from. Positioning and anatomy of the feet will work its way all the way up and have an impact on the lumbar spine as well. We'll talk more about this later, the thoracic spine here, and you can see she's not too bad either, but she kind of collapses forward a little bit, as a lot of people do. So go ahead and stand up tall. The thoracic spine, when it gets stuck, when it gets limited in terms of extension, that'll also have an impact on the low back as well. So almost every time that I'm treating low back pain, I'm looking at the thoracic spine and treating it in some way or another. Not always, but most of the time. There are a lot of different injuries that can take place with the lumbar spine, and that includes everything from herniated discs, bulging discs, stenosis, which is a narrowing of the vertebral canal where the spinal cord goes through. You can have just a muscle strain and facet joint degeneration, arthritis, spondylolisthesis, which is when one vertebrae slides in relation to the other. And a lot of times these conditions will kind of reinforce each other, so you have multiple ones happening at the same time. But the bottom line is that low back injuries, it's really important to know what you're dealing with in terms of a diagnosis, because the treatments might differ depending on what the diagnosis is. So it's important to really look at the unique anatomy and have an idea what's happening in terms of on a clinical level while approaching a treatment for low back pain.